Please, let's try and settle down. Okay. If you recalled, I did say that if we have a representative of the three ministries, Ministry of Women Affairs, Ministry of Health and Social Welfare, Ministry of Education, we will just take a two-minute message from them. But since I don't think we have any of their representative present in the room, if there are, please indicate. I will make sure you have the 2 minutes to come up and speak. So without ado, we move to the panel discussion. Based on the thematic panel, the first one is on sexual and reproductive health, education and empowerment in displaced setting. We have our facilitator for that, Mercy Bolaji Taiwo, the technical support lead, SWAG initiative, to come forward for moderation of that particular session. You are here. Thank you. Now you can introduce your panelists while we stand. If there are times, we'll indicate if your time is. Please sit, then you can start bringing them up. Yeah. Which one?
This for the goodwill message is just maybe 2 minutes.
Oh. Good afternoon, everyone. Okay, permit me to stand, please, for now. I know we just had tea break, so maybe we should do a little energizer, because that could set the pace for the meeting. Okay, ma.
Okay, you can have the energizer. We have a 2 minutes goodwill message coming from. Okay, so I was just informed we have for a 2 minutes goodwill message, Mr. Ayuba Richards of Federal Ministry of Women Affairs. I don't know whether he is being represented by Hajia Ramatu Ajoji Habu, Director of Special Duties, Education Secretariat. Okay, we have two of them. Please, if we can have the one for the Minister of Women Affairs to come forward, please, so that we can have the 2 minutes with him, Mr. Ayuba Richards. Can you give a round of applause for Mr. Ayuba Richards to come forward? Okay. Please give him a round of applause as he walks in here. Mr. Ayuba, you're most welcome for your 2 minutes.
Thank you very much for having me. Like she rightly said, my name is Ayuba Richard Dapun from the Federal Ministry of Women Affairs. I want to appreciate you kindly for this opportunity, and I want to appreciate the organizers for this wonderful initiative. I myself, I was called upon abruptly by my director to make sure that I'm here because we are he for she. And then he appreciated this gathering. He saw the need that we should be here. And that's why he said, okay, I should come here on behalf of the ministry and appreciate you for this wonderful initiative. I thank you very much, and I wish everything is the director that operates on open door policies. And whatever we discuss here, we will join this initiative, we will join this campaign, this advocacy, to make sure that, yes, the IDP is a safe place for every person that find themselves there by accident, by chance. Some of us were here because we are privileged. We don't know the next minute where we'll be, but we appreciate every of this privilege. Thank you very much, and have a wonderful experience of this program. Thank you.
So, again, we have our second goodwill from the Ministry of Education, Hajia Ramatu Ajoji Habu, for her goodwill message. 2 minutes. Can we have a round of applause until she makes her way up?
Thank you very much. I'm Ramatu Ajoji Habu from Education Secretariat. I'm standing in for the Secretary for Education, and I really want to thank the organizer for finding it to invite us for this all-important program. So far, I came late, but I have carefully followed the keynote speaker. We are from Education Secretariat. We will observe with keen interest and identify areas that concern us, and by the special grace of God, we will really take firm action. As far as IDP is concerned, it's really our concern in FCT. Therefore, from the Education Secretariat, we will make it very necessary to ensure that the children of the IDPs are well educated at that level. Thank you very much, and I really sincerely thank the organizers for really thinking it wise to organize this kind of gathering. So we follow it carefully, and by the grace of God, we will do as expected.
Thank you so much for that very hard-hitting commitment. We've heard a lot of commitments today, and we can only hope and pray that the organizations, which I know they will stay true to their word. So, Mrs. Mercy, over to you.
Thank you so much, Isabel. Welcome back again from tea break. It's now time for the first panel session. I'm sure you are as excited as I am. And this panel session is going to talk about sexual and reproductive health, education, and empowerment in displaced settings. And I can assure you, this panel session is with a difference because we would have panelists from international organizations, from organizations working at the grassroots level, from one of the teachers of from this IDP camp, who would be talking about practicable solutions to the problems of IDP. So and that's why I said the panel session is going to be with a difference. Permit me to welcome our panelists, and the first panelist I'm going to be inviting on stage is Mr. Karshi, who is the headmaster at the LEA Primary School in Warsaw, internally displaced person. Please, let's do better by appreciating our panelists. Thank you. Thank you so much, sir, for coming. Please come up stage and have your seats. Thank you. And the second person, the second panelist that we'll be having is the Edidiong Simon, who is the country director of Area I. Please permit me to bring her on stage with a round of applause. Thank you. Thank you so much for coming. We'd also be having the third panelist that we would have on this panel session is Dr. Kel, who is the SRH specialist from UNFPA. Please put your hands together for him. Thank you so much. Thank you. Thank you. You can do better. Thank you. And the fourth person we would be having is Mr. Hassan Dogo, who is the Chief Relief Officer, Food and Nutrition Unit, National Emergency Management Agency, NEMA. Can we put our hands together for him as he comes up stage? And the last, but not the least, is the beautiful Adiza Mohammed, who is the Communications Officer of Nigeria Health Watch. Can we put our hands together for her as she comes up stage? You're welcome. You can see that the panelists are power-packed, and it promises to be an engaging session. The panel, the conference theme is re-strategizing investment and amplifying the voices of women and girls in internally displaced communities. And this panel session, like I rightly said, is on sexual and reproductive health, education and empowerment in displaced settings. It cuts across all our thematic areas, and this afternoon we're going to look into these topics as we bring about solutions, durable solutions. We've heard a lot about sustainability, a lot about durable solutions, and this panel session is going to end on that note. as we know that Nigeria is experiencing one of the largest internal displacement crises in the world, like we've heard, and primarily driven by insurgency, insecurity, and natural disasters. And according to the International Organization for Migration, IOM, as of 2023, there are over 3.2 million internally displaced persons who are living in Nigeria, and with majority in northeastern region due to the ongoing Boko Haram insurgency. And the displaced population is predominantly made up of women and girls, who represent over 80% of the total internally displaced persons in Nigeria. This crisis, as you may know, has disrupted lives. It has also led to the loss of livelihood, which most importantly affects women and girls, and with significant barriers to their access to education, healthcare, and economic empowerment. Stand With a Girl initiative as an organization working in these communities has adopted a tripartite approach to programming that integrates education, health, and empowerment, because we know that these are the answers to the problems that persist even in internally displaced communities. And with this, we've been able to ensure that our strategies holistically addresses capacity building strengthening for women and girls to be able to advocate for their rights, because we believe so much in advocacy-led initiative that would lead to sustainable solutions. And for us, this is why we are doing this, because we believe that when a woman or a girl is empowered, she's able to advocate for her rights, and most importantly, live a healthy life that can contribute to the economic development of Nigeria, of Africa, and the world at large. So in order not to talk too much, we have panelists who would be, talking through these themes. And I would like to go straight to the first person, who is Mr. Karshi, who is the headmaster at the LEA Primary School in Wasa. And my question to you, sir, is that how can we ensure that displaced girls stay in school despite challenges like insecurity, cultural norms, and lack of resources? The mic. You can turn it on. There's a red button there. Just turn it on and speak. Thank you.
Thank you, Ms. Mercy, for giving me this opportunity to speak on how will girls stay in schools, for the fact that there is challenges that has to do with norms, culture, and other resources across the IDP. I want to, first and foremost, let this panel understand what is the concept of education itself before we talk about the girls staying in schools. Education, it has to do with the process of transmission of knowledge, skills, and developmental character trait of an individual in the society. Now, to get this effectively achieved, we need to put some things in place to ensure that we have effective teaching and learning, most especially that has to do with the girl's child's education. If you invested today in a girl, you are investing in her future. If you invested today in a girl, you are investing in the future of the world. To ensure that these our girls stay in schools, first and foremost, let me itemize them in this way. We have to ensure that we provide the school with the basic facilities it takes to ensure that they make judicial use of it in schools. One, the perimeter fence in an institution or in school need to be put in place. For example, like my school, where I'm heading, LA Nomadic Wasa, and 70% of the pupils are from the IDP camp. But unfortunately, we don't have perimeter fence. And you could see that there is no how we will not allow these children to observe their short break and their long-term break. But when it is time for them to go back to their classes, how do you achieve that when there's no fence to ensure that maybe they are caged within the school, they spend their breakfast time there, And by the time once the break is off, they go back to their classes. But when there's perimeter fence, we can achieve that. In absence of perimeter fence, they have many exits, and it will make it very difficult to have total control of these pupils. But with fence, I believe you, there will be 90% total control of the children within the school. Secondly, source of water. Source of water. We need to have water within the environment, within the school premises. For the past, since I assumed in that school, since 2022, we don't have source of water. It was just last time that an individual that came, because we have been buying water on a daily basis, and said, oh no, we can't continue this way. The way the children are going about to go and buy water within the community is not a good one. We need to dig a well, and that is where we started. And by God's will, we'll have something very close to us by improvising to ensure that we have these children within the school premises. We have to also ensure that we have the community policing. We train the community on security matters so that at least they should be able to withstand the situation on their own. Both the teachers, the parents, and other stakeholders in the society. It will help in checkmating these activities. And one of the major to ensure that we kept these students, most especially girls, in our school is also to ensure that we have school buses that will be taking the children from their home to the school, and as soon as the school closed, they take them back home. Because something funny may happen at the process of either coming to school or going back to school on their own. We cannot checkmate them or have access to have to control these pupils. So please, it's very, very important to see that we provide perimeter fence, we provide source of water, we have good toilet for the pupils and the staffs, we have the furnitures in the schools to ensure effective learning and teaching within the school premises. And please, you could see that one of the challenges we are having today in the school, LA Nomadic was as a case study. We have about 7 public schools, LA schools across LA Nomadic Wasa, but we don't have a single public government secondary school. You could see that an IDP with about more than 3,000, including the host community, don't have a secondary school. I'm calling on government and other CSO that are here, civil society organizations, to please to put effort in place to ensure that this community, this IDP, they have, for the fact that through SWAC initiative, we have started a move towards that directive. We wrote to FCT Universal Basic Education, and by God's willing, the board chairman sent about 4 deputy directors to my office to find out how are they going to go about it and what are they supposed to do. How do we do to start up this an institution? I believe we are still waiting for that. And before I maybe call it off here, I want to recommend SWAC initiative. Because when I assumed it in that school, could you imagine a school with population of getting to 400 pupils? 70% of them are sitting on the floor. 70% of them. But fortunately, with the help of this organization, SWAC initiative, through the IDP, let me say Refugees Commission, they were able to supply the school with about more than 100 people's desks. I'm assuring you that as I'm talking to you today, we are achieving effective teaching and learning. They renovated about 2 blocks of classroom in the school. Could you see that the academic standard in the school is busting? But perimeter fence is one of our challenges. People's toilet. You could also see that we lack the securities in the camp, because I want to, frankly speaking, table this here, because I got a report. One of my pupils in primary 2, although it happened at home, for him to just inform his younger one that, please, tell mommy that I've gone. Tell mommy, where did he go? Tell my mommy that I've gone till we meet. Till we meet where? So I don't know what the solution to that. I'm still finding about that. It happened within the IDP camp. And all this is happening because of security challenges. Thank you so much for giving me this opportunity to talk to you.
That was great. Thank you so much, Mr. Karshi. It was, I mean, when you see a teacher, you will know one. I don't know if you saw that vibe and that move in the way he was speaking. But beyond that is, there was something that he said, and I'm able to come up with to say that there's difference between learning and effective learning. And for there to be an effective learning, in order to overcome the challenges of education, is being able to identify some of these issues that could be a barrier to effective learning. I hope that we're taking note and we're looking into providing sustainable solutions to these issues. Thank you so much. Please, let's give him another round of applause. Thank you so much, sir. Can you please turn off the mic so the other person can speak? Yeah, thank you. All right, over to you, Area I. Eddie Diong, I would like to ask you, how can we strategically design and implement resilient education systems that ensure uninterrupted educational continuity for IDPs, children, particularly girls, in the face of protracted displacement and destabilizing effects on their schooling and social environment? Over to you. Yeah.
Okay. Thank you very much. So as not to overflog the issue, we already understand the crisis that we are dealing with respect to displacement. However, we already know that there's already a global learning poverty. Currently, we have about 90% of children in the displaced population who are already suffering from learning poverty. That is, they are not able to read or understand basic arithmetic or basic literacy. Now, this is actually a problem because while we are looking at themes such as sexual and reproductive health, empowerment, if you have a displaced person that does not have basic foundational skills, how will they be able to get other skills to be able to thrive in the society? So if they do not have foundational skills, while I understand that there's currently an advocacy for a secondary school, we have also worked in Wassa IDP camp, and we have worked in multiple IDP camps in Makurdi, in Borno, in Karmajiji, across several IDP camps, even in collaboration with the NCFRMI Commission. One of the challenges that we have observed is a drastic gap when it comes to learning poverty. You find children, even adults, aged 14, 15, 16, they cannot read basic sentences. And these are the same people that we want to push out into the society to become empowered, to return back to stable lives. So in response to things, one of the first things we should look at is a holistic community engagement approach. How can we work with their community to identify areas of their need? That is the only way we can do that. For every educational intervention, we all agree that the educational needs of a displaced person is not the regular needs of the average Nigerian child. So we need an educational system that is much more holistic, that combines different aspects such as psychosocial support, foundational skills, including transferable skills, as well as emotional skills as well, to help them cope. Would I call it sadly or funny enough, when we did like a baseline assessment in one of the IDP camps and asking most of the children, what are your career aspirations? Most of the feedback we got from the children, sadly, was they either wanted to be a police officer or a soldier, because they felt that if they are able to fill in these roles, they might be able to protect their family from insecurity in the future. These children are actually traumatized, coupled with being displaced. So in building a resilient education system, we are looking at having a holistic community engagement approach. We are also looking at having a very holistic program design when it comes to their education. As I highlighted, we cannot work with the average or the basic curriculum, and we need to do this also in an accelerated way. You can't have a 14-year-old or a 15-year-old, you send them back to crèche or you send them back to primary 1 to begin to start. It has to be an accelerated and, would I call it a effective accelerated learning approach. It's not just about it being accelerated, it needs to be effective. Another thing we also need to look at is leveraging digital technology. Permit me to also draw from one of our interventions called Fast Track, which we use to deploy foundational skills to children, both in marginalized communities as well as in IDP camps. We leverage 3 different tri-dimensional approaches. And one of the things, we use the teaching at the right level methodology, which ensures that learners are grouped according to their level of understanding. So this is another way. As I mentioned, we can't send them back to primary 1, primary 2 to begin to start. You have to identify them based on their level of understanding, and then you deploy that accelerated learning to them. Another thing that we also have is like an offline talking book and pen. This is an integration of technology. What does this do? It ensures that the children are interested. Just as Mr. Karshia has already mentioned, once it's 10 a.m., the children leave classes. It's not only applicable to WASA. We also observe that across several IDP camps and schools that host IDP within a host community, they all leave. They are not interested in the educational system, or the environment is not even safe. It's not even conducive for them. Another thing we also need to look at is how can we create a stable learning environment, an alternative stable learning environment. We might not be able to get the requisite funding or the requisite resources in the immediate to say, let's create, so let's look at something alternative. I've mentioned community engagement, good program design, leveraging digital technology. Why am I talking about this? Through that technology, it got the children engaged. They were actually interested, and it's an offline technology. We don't need light, we don't need solar or a lot of electricity to power that. So leveraging that, the children are always excited and are looking forward to their learning sessions. And so it ensures that we have a system that incorporates all of these things. Finally, let's talk about psychosocial support as well as basic skills for survival. I've already highlighted that they do not need just the basic curriculum. So this psychosocial support teaches them things about communication, how to manage their emotions, how to manage stress, and become, more productive members of their society. Thank you very much.
Right. Thank you so much. Please, let's put our hands together one more time for her. That was really great. And I think that one thing that stood out for me is accelerated efforts. I think it's not just a cliche, in the sense of us just saying it the way it is, because for us this is 2025, and 2030 is just a stone throw. And for us to be able to achieve SDGs goals, we need to be accelerated, right? For lack of a better word. And acceleration would do it. And we've been able to see how that all of these factors put together would ensure that there's an accelerated effort to meet up the years that have been lost so that we can achieve what we want to achieve. Thank you so much, Area I. I would now go down to UNFPA, and this time around we'll look into health, and we'll be looking at how we can ensure that, so we know how UNFPA is doing a lot of interventions in across the different areas, and especially even in IDP camps. So my question to you is, how is UNFPA addressing barriers preventing women and girls in IDP camps from accessing family planning, maternal health, and gender-based violence services? Yeah, over to you, Dr. Kel.
Yes, thank you so much for this question, and also allowing me to speak on behalf of UNFPA. Okay, so as you have said, say IDPs, women and girls face significant barrier in accessing the, let me use the term SRH, because the term SRH cover the issues around family planning, maternal child health, and also gender-based violence. So the accessing SRH and GV service, it's also a challenge for the IDP women and girls. So for several different reasons. UNFPA being the Sexual and Reproductive Health Agency, work around this area to improve access to the healthcare services. And okay, the challenge primarily around the availability, accessibility, and acceptability of the services. So UNFPA is trying to address in several different ways for the women and girls, for them to be able to exercise their rights. That's basic SRH rights, and also to fulfill the goals of the UNFPA. That is ending unmet need of the family planning, ending preventable maternal death, and end gender-based violence. So for the availability, UNFPA work with the government and also NGO, INGO partners, including the women-led organization, to provide SRH and GV services in the camps through the healthcare facility, women and girls safe spaces, and then one-stop service centers. So additionally, community awareness and mobilizations are also very critical in this case, and raising awareness about the availability of the services and how the IDPs women and girls can access these services, and combating the stigmas around the sexual and reproductive health, menstrual hygiene management, and also engaging with men and wives is also the key. Engaging with men and wives to shift the harmful social, cultural, and all these traditional norms that prevent women and girls from seeking the services that they want and that they need. So, and also UNFPA procure and also ensure the availability of the different types of medical commodity in the humanitarian setting. We say the reproductive health kits. Even at the onset of the emergency, UNFPA ensure that these supplies are available to make them available for the women and girls that are in need of these services. For the accessibility, why most of the UNFPA supporter facilities are in and around the IDP camps, UNFPA deploy the mobile teams to ensure that we can even reach, the mobile team can even reach to the disadvantaged community in the hard-to-reach location, even at the onset of the emergency, before they reach to the settlement site or the IDP camps. And also UNFPA deployed the fabricated mini ambulance to bridge the gap in the transportation, especially for the provision of the emergency obstetric care for these women and get access to the emergency obstetric care services. So one other the initiatives and pilot that UNFPA is currently doing is the cash and voucher assistance for the IDP women and girls as part of our GVV case management and also SRA service provision for the women and girls to give the flexible options for women and girls to improve access to the services, removing the financial and logistic barriers. The other aspect is the acceptability of our services delivery. The acceptability, so culturally sensitive and the trauma-informed care is critical in this case. That's why UNFPA train service provider for them to be able to provide the survivor center and the client-friendly healthcare services and the respectful maternity care, all these things that UNFPA provide trainings. And also UNFPA advise and support the holistic approach of the service delivery, integrating mental health and psychosocial support as part of the SRAGV service provision. Because these also support recovering the women and girls, the experience of stress and trauma because of their displacement status. So sometimes this stress and trauma could be the barrier to accessing the services. So by employing all these multifaceted strategies that UNFPA strive to dismantle the barriers that women and girls, the barriers that prevent women and girls from accessing services that they desperately need. So thank you so much. Yeah.
Thank you so much, Dr. Kel. Please, can we put our hands together for him? And we can see how that addressing barriers preventing women and girls in IDP camps from accessing SRH services requires a multifaceted approach. And in the spirit of leaving no one behind, we've seen how that UNFPA is working to ensure that everyone is reached, including working with community mobilizers, ensuring that those who are hard to reach are also reached with services, those services that would ordinarily not get to them. Initially, is that, services are even scarce, but the fact that it's in a displaced settings, it makes the services farther than you would ever think. And you can see how that they are moving these services closer to them. Thank you so much once again for your intervention across Nigeria and across the world. Right now, we'd go over to Nema and would like to ask, how can emergency preparedness strategies be improved to prevent disruption in essential services like healthcare, education, and even livelihood? Over to you, sir.
Good afternoon, all. Let me start by thanking SWAC for this laudable project. Emergency, as you know, are incidents that occur that is within the coping capacity of an individual of a community. And there are measures that can reduce the impact of that emergency on social services, such as health, education, and livelihood, which he asked for. To start with, no emergency strike without early warning. Even you, in your various homes, husband and wife that quarrels, there are signs that, yes, quarreling is coming. Nothing happened without that is the early warning. So one of the factors, one of the measures to put in place, first and foremost, to mitigate the destruction of emergencies on social services is how you manage your early warning. How do you manage early warning? Like in this year, there was a prediction from NIMET that there will be flood, which will affect ABC state. What do? The humanitarian actors and emergency managers have to go about to do a stakeholders meeting with all these affected states, bringing them closer that see, trouble is coming. How do we manage this trouble so that our schools' health will not be disrupted? So how you manage early warning speak a lot on how it will reduce the impact of that disaster. Another example goes, in a family of husband and wife, and there's a sign of quarreling, the husband can quietly use his understanding and step out of that room for the few time or hours before he returns back. That man has used early warning message to avert the impact that will occur as a result of that quarreling. That is how good it is for you to manage early warning to avoid the same disaster that will affect schools and health centers. Number two factors that you can improve on to avoid disruptions during emergencies in health and education is partnership with governmental agencies, such as National Assembly. You know, both government and non-governmental organizations, the only money that you can spend freely without being appropriated is your salary. Even this gathering that we are today, there is an appropriation which give rooms to this gathering. So the National Assembly need to be involved in the appropriations of measures that can avert impact of disasters on schools and health centers. Equally too, personal and community resilience is another major factor that can be improved on to reduce the impact of emergencies on schools and health centers. Every disaster is local. Even where we are here in Eastern Adult Center, this is a community. It's a local communities. And when any incident happens, the first people that respond to any incident is the local people. So the resilience of those people need to be built at the peace time. The resilience of the community of that people need to be built. Because if there's an incident in Osun State in the local government, which is affecting the schools and health center there, before you leave your comfort in Abuja here to go to that Osun State, damage must have been done. But when you build the resilience of the people and the community there, they will be able to use their capacity to manage the effect of that disasters in the schools and health before you get there. Another major factors, again, that we used to mitigate the impact of emergency on health and education is regular stakeholders meetings with all the stakeholders. On health, at a peacetime, there must be a regular meeting with the Ministry of Health once an early warning sign of a disaster is being known. Emergency is coming. Ministry of Health, please, how do we do to protect health? But through that measures, regular stakeholders, alternative measures can be provided to reduce the impact of that incident on health. Same things go to education. Through the measures, regular collaborative meetings, haven't we known that, yes, we are expecting incidents that will affect education here? Those in education sectors can be asked to provide another alternative. Because what we have today, whenever there's any incident, the first place that people move to is school. And by so doing, education of the children is being disrupted. But through stronger collaboration, the Ministry of Education or the government can provide alternative avenue by building shelter, resettlement homes, whereby if incident happen, instead of people to go and occupy a school, which will disrupt the activity of the school, they can now move to resettlement centers. These are measures that can be put in place to avert the destruction of incidents during health and emergency. Thank you, ma'am.
Thank you so much, sir. Can we put our hands together for Mr. Hassan Dogo? Thank you for letting us know that coordinated efforts is very important, and early warning, like he rightly said. And I also like the relatable example that you gave, and if maybe anybody is going to forget anything, that example is going to be with everyone as we leave, that it's in the real sense of it, you just have to, prevention is better than cure, not just because we want to say it, but we should have also prevented it from the second instance you gave, and also about how that you would have seen the signs before it comes. And I think these are very important for us to ensure that we prepare in terms of emergency. So thank you so much for your response. And we move over to Hadiza Mohammed from Nigeria Health Watch. We want to talk about the media because we see that it's very important for us to see how media can be, added to this conversation, and how people out there can see, and how these voices can be out there. So I'm going to ask you, Hadiza, what role can the media play in amplifying the voices of displaced women and girls, influencing policy, and holding stakeholders accountable? Over to you, Hadiza.
Thank you very much for the question, Mercy. Good afternoon, everyone. I'm honored to be here today and representing Nigeria Health Watch on this important conversation around internally displaced women and girls, influencing policy, amplifying their voices, and holding stakeholders accountable. So I want to start by saying media plays a critical role in what we do as a society. At Nigeria Health Watch, we leverage media on whatever that we do. So we do that through storytelling, through advocacy videos and stuff. So we leverage radio most times. I could say that the maximum radio shows we go on in the month should be like maybe 5 to 8 in a month. So that storytelling comes as a form of advocacy for the work that we do. So we have a project called the Community Health Watch Project. So this is an example of a grassroots intervention whereby we leverage radio and then people from the community phone in to express the challenges they face in accessing healthcare. It can be around maternal mortality, it can be around neonatal mortality, nutrition, immunization, among others. For the IDPs, I think it was in 2022, I wrote a story, or should I say Nigeria Health Watch, because that is what we normally do. We wrote a story about a TBA. Her name is Liliatu Ayuba. I was surprised I did not see her here. So she served as a TBA, and then, but when she came to the camp in 2014 as a result of the Boko Haram insurgency. And then when she came, she didn't start it like from the scratch. So a lady trekked from Cameroon or something, and then when she came to the camp, she was like 7 months pregnant, and then she was rushed to a healthcare facility. So because they were IDPs, they were not considered, they were not covered by any health insurance. So they were pleading for her to be admitted, and the process, she gave birth, and then she lost her life and lost the baby. Liliatu was telling me that she pleaded from the beginning, but they told her that she had to make a deposit of 150,000 naira, which they couldn't afford it. She was told to go to, they asked her if she was a Christian or a Muslim, and then she told them that she was a Christian, and they told her to go to the church and beg. Imagine that coming from a healthcare facility. So she cried that day, and she told me that since the time that her grandmother taught her, she promised her not to start until she reaches the age of 40. And as the Liliatu Ayuba stepped in to change that narrative, she intervened to stop the challenges women face in losing their lives and their babies in the camp. So because we use media to advocate for things like that, I wrote the story, and then Liliatu afterwards got a clinic. She got all the instruments she needs in helping women deliver in the camp. Also, last year, to mark World Water Day, we were at the IDP camp in collaboration with the Rotary Club, the Ministry of Health, NIWI, Nigeria Institute of Water Engineers. We intervened because we felt they need access to wash facilities. We supported them and also taught them how to make reusable sanitary pads. We taught them how to use air fresheners, liquid soap, not just for their personal use, but for them to generate income, right? Another thing I want to emphasize on is holding our stakeholders accountable. So we organize policy dialogues, and then we organize stakeholder engagement. So we bring this kind of conversations, right? Media, we use, like I said earlier, we use traditional media, that's radio, TV, and print, newspapers. We use social media to amplify the voices of women and girls, especially from the grassroots level, right? So we also have a project called the Solutions Journalism Project. So when we use media, we don't always focus on the things that are wrong or the problems, but we rather focus on the things that are working. The example I gave earlier about the TB in Durimi IDP camp is an example of solutions journalism. It's been implemented in Kenya and Nigeria, and it started in 2021. It's been funded by the Solutions Journalism Network. So it's solution journalism trains journalists and teach them how to write solution-focused stories, not always focusing on the problems. So that when people out there read these stories, it can be an organization, it can be an individual, they can try to replicate it, right? Holding stakeholders accountable, I've already spoken on that. Okay, I think I'll stop here for now. Thank you.
Thank you so much, Hadiza. That was beautiful. We've seen how the power of media cannot be, just left out of the conversation. Media has proven to be that powerful tool to reach people, even those who are hard to reach, using local media, those who can be reached. And we've seen even how social media is giving waves, and then people are able to be reached. But most importantly, it's not just about reaching the people, but reaching them with the right stories. We've seen how she's been able to establish that somebody moved from point A to point B, and it brought about solution. But that's just one in a million, one in a billion of people who who are in dire need of solutions, especially even in internally displaced communities. That's the first round of our, panel discussion. We'll now open it up now for questions. And afterwards, you would respond to the questions based on maybe the one that it's specifically asked to your organization or based on the work that you do. And then we'll go for final closing of the panel session. I told you initially when we started that this panel discussion is going to be solution-driven. Did we try? Did we do it? Hello, everyone. Are you still in the room? Do you want to stand up? All right, so it's now time for question and answer. If you have questions for the panelists specifically, or you have questions or contributions, we would like to take them. Okay, I see one hand up, two. No, where are the women, please? Okay, three, and I'm sorry. I think I need another woman, please. We already have two men. Okay, ma. So we have four, right? Okay. Now he's going to come here to arrest me because I told him no. But because you can see now, it's you know what I'm saying. Okay, so let's have the first person, and then we'll take the first two people would ask their questions, so we do not forget, and then you can answer them, and then afterwards we take the next three people. Please, can we have the other mic passed to the person who is asking the question? The compers should have the other mic with them. Okay, in the meantime, you can have this. Find the mic. Just
All right, so thank you very much. I think it's been a very rich conversation, and I'm grateful to be a part of this. I just wanted to appreciate the panelists for such a great job, and my question is really very straightforward. The lady from Area I, you talked about learning poverty, and I'm excited to hear you mentioned that because I wanted to find out from your experience, what is the current prevalence of learning poverty in Nigeria? And has your organization done any sort of comparative analysis to look at the prevalence among the general population vis-a-vis the children in the IDP camps? Because I know that learning poverty is currently in national minors. It's a problem everywhere, and we want to be able to say, as it relates to children in IDP camps, is it more of a problem? How much more children in the IDP camps come down with learning poverty as compared to children outside IDP camps? That's one. And then secondly, it will be important to help us understand if there are unique problems, very unique problems that are accentuating or, increasing the prevalence of learning poverty among children in IDP camps vis-a-vis children outside IDP camps, and how can we develop targeted interventions that are driven at closing those gaps for children in IDP camps? Thank you very much.
Thank you so much, sir, for your question. So initially we mentioned that we'll take two, but let's have all the questions, and then the panelists will take notes and then respond to them. And please, thank you so much for your question, but because of our time, kindly limit the questions to just one per individual so we can, get to order. All right, thank you. The next person, please. Yes, thank you.
All right, good afternoon. My name is Daniel. I'm from Area High. Actually, I want to contribute a little, not question, and I'll be brief about it. And when Edidion was talking about the holistic educational approaches. Yeah, I want to, based on my experience so far in camps, one of our programs has a component whereby we facilitate 21st century basic life skills. Then I entered the class and I told the teacher that you will help me to speak in the language of the learner. Immediately I find out that the teacher disappeared after the class. I said, sir, but I said, he said I intentionally leave the class so that you can have experience of what we are facing. Inside the class, I count more than 70 learners. How do you expect the teacher to cope? And this also can resonate with what the head teacher has said. So having this kind of population in class, at least the learners will not have interest in learning. Teacher won't be able to cope. That is one of the problems we are facing. Overpopulation. Then a teacher is handling such population. So that's number one. And the second thing I now want to say is that not only having numbers of facilitators or teacher, empowering teacher on how to facilitate foundational skill or teaching. Let me just put it that way. This is one of our experience so far, that we have teachers in the class, but these children are not learning. They are just there. So we, in our own way, we develop a means in which we empowered facilitators on how to teach these children, on how to equip them with the right skill teachers need to facilitate those skills. So I see that there are insufficient or lack of facilitators or teaching in the school, and at the same time, teachers are need to empowered on how to facilitate those skills.
Yeah. Thank you so much. Please, let's put our hands together for him. Thank you for the beautiful suggestions. Yeah. Can we move on to the third person? She's over there. Yes. Thank you.
Thank you so much. I would like to appreciate the panelists for their contribution today. Mine is just a little contribution. Issue of media and sensitization. I think we really need to strategize it and also to look into it, because most of our IDPs, more especially in Yobe, the IDPs are not settled in a camp. We don't have any official camp in Yobe. Our IDPs are at the host community, and they have been separated all over the state capital. So on the issue of services provided, we have so many services on ground, but some of the IDPs, they don't know how to access these services. So we need to intensify our sensitization to create awareness on the existence of these services provided for them. I would like to also applaud UNFPA. They have done so much because they have service providers at the community, which is under the Ministry of Women Affairs. And these service providers are working at the community level, sensitizing them on GBV prevention, the existence of SAC centers, and also ensuring that the IDPs are being looked after and their children go to school. So based on this, I think the UNFPA need to strategize and also increase the number of service providers because they are not much enough to cover the state. So thank you so much.
Thank you so much, Ma. Please, let's put our hands together for her. Thank you for the beautiful suggestion. Can we have the fourth person? Okay, yes, she's over there.
Thank you. I think I'm going to remove my cap as COA facilitator now and wear the cap of PhD candidate. So listening to all of you today, it's been tinkling my fancy because again, my thesis is looking at the intersection between gender, internal displacement and human security, which I mean, SRHR and education and all of those things are a part of. However, what I have observed from research is all of these things are not being documented, which creates two problems. One, it creates the notion that nothing is happening, and two, it makes us work in silos or duplicating efforts. And I think that, you know, people who are implementing for IDP camps should continue to document, talk about all of the things you are doing. engage researchers, engage consultants to put these things in a document, publish it online, so that people like us are not going with the notion that nothing is happening because there's no evidence to back all of the things that are happening in the back end. And, you know, it helps us move from where we are, or it gives us a better picture of where we are, so that we know the things that are lacking and the gaps that need to be filled, so that organization A, organization B are not working on the same thing when we've, you know, overflocked that part and then some parts are being left behind. So that's what I wanted to say. Thank you.
Okay, thank you so much. Let's put our hands together for everyone who has contributed. That was really great. Valid points are made. And I'm sure the panelists have also taken note, and every other stakeholder in the room. So I think I would hand it over now to Area I. That was the question, was specifically for Area I. Over to you. Yeah.
All right. Thank you. So I think one of your first question is trying to understand if we have metrics to compare the level of learning poverty. So we are working with the metrics shared by UNHCR, UNICEF, World Bank, which shares that we have, according to UNICEF 2022 report, that we currently have a 70% learning poverty rate in Nigeria. Now, the World Bank also, in collaboration with UNHCR, states that for countries where children are living in violence or, you know, or conflict, the rate of learning poverty is actually higher. That's by 90%. While we do not have the resources to conduct a national survey as to compare the rate of learning poverty in IDP camps with respect to, you know, the general rate in Nigeria, from our experience that we have implemented programs across several IDP camps in Benue State, in Abuja, in Nasarawa, as well as in Maiduguri. We also implement programs in marginalized communities, that is in a regular school, a rural community, as well as in IDP camps. The rates from our own data, the rates of learning poverty, or there is actually a deficit in foundational skills, it is higher in IDP camps. I think another question you asked is, what are the unique factors that contribute to this? Number one, these children's education are disrupted. Even their parents, their source of livelihood is affected. So most of them do not even have the resources to continue education. Everyone would first of all prioritize basic sustenance, their health, what to eat, shelter. And if you visit these camps, their place of living, they are not even habitable. It's not even health. Is it health worthy, or is not healthy at all? It's very terrible. So at that point, they are thinking of sustenance, and would rather prioritize their resources towards health or towards, you know, sustainable living as opposed to education. So I don't know if I believe I've
I think you have
responded to all your questions. Thank you.
All right, thank you so much. Let's put our hands together for Area I. If you have further clarification on questions, it's open. You can meet Area I. You can meet any other stakeholder that you feel that you just need to talk to them about one thing. In closing, would like to hear from you, your final statement, not because it's your last day on earth, but but final statement for this panel discussion, and just in 60 seconds, please. In closing, what would you like to say based on everything we've said? We started from the other way, now we'll start from you, Adiza, and then we'll go around. Yeah, thank you.
Okay. Thank you so much, everyone, for listening. Thank you so much, Ma. You made emphasis on leveraging media in doing our advocacy work. So like I said earlier, we leverage radio, TV, and newspapers to amplify voices of women and girls and communities in hard-to-reach areas. So I would say that we don't have to go to the grassroots. Sometimes we hold virtual radio shows. I could remember in 2021, I wrote an article on early child marriage. So I felt there was the need for me to educate Northerners, since in Northern Nigeria, we have high prevalence of early child marriage. So I decided to go on the radio and also in the language that they will understand. So I was surprised that they criticized my message, right? They were saying all sorts of things. They were not willing, like, they were not ready to listen. But that doesn't stop the advocacy. A few months back, a colleague of mine wrote an article of how Sierra Leone was able to mitigate the impact of negative impact of early child marriage, which Nigeria can learn from. So I still went back with him to educate Northerners, and then I was surprised to see that it was really engaging, and then they were beginning to understand the negative impact of child marriage. So I want to say that I could see my media people, that's how I call them, my media people, because whenever I call them, they never say no. So I want to say that you're doing a great job, but still, there are challenges along the way, I know that, but we cannot say because of so challenge, we're going to put a stop. We have to continue, we have to pass the message until it reaches the ears that we want people to know, and also until we see the positive change that we want to see. And also to our stakeholders, I want to say thank you, and I want to also solicit that you partner with us in amplifying the voices of women and girls. Thank you so much.
Thank you. Yeah, over to you, sir. 60 seconds, please.
My final word is just to appeal to all of us as Nigerians to make the system work, please. At whatever level of endeavor that we find ourselves, please, let's make the system work. If the system works, it's for the benefit of I and you. If the system is not working, it's I and you that will suffer it. Today, even if you have 1 million naira or a million naira to pay in a private school, you may not have that means to construct a road to your house. But when Nigeria is working, there will be a road to your house. When Nigeria is working, IDP will disappear from Nigerians. When Nigeria is working, your healthcare can be free. If Nigeria is working, education of your children they can access education free. So I'm appealing to all of us, please, at all levels, let's make the system work. Thank you.
Much. Let's make it work.
Me, I would like to stress on the point that on the needs of the coordination and then linkages with each other, the service provider. Also understanding from the point that raised by one of the participants regarding these the working in silo. So looking at the humanitarian environment for the moment, and also looking at the scarcity of humanitarian resources in Nigeria and also around the globe, that we need to really strategize the way how we intervene the activities. So it's very important and critical that we work in a collaborated approach. From the aspect of the UNFPA mandate, SRH and GBB and some other partners are also working in this area, that we need to provide integrated approach of the service delivery. It's not just SRH, it's not just GBB. We need to provide integrated service delivery. Also, the theme for this discussion is around the education, SRH, and empowerment. So I also see the linkages between the education and SRH as well, because the education, so it's very important to integrate the comprehensive sexuality education, because comprehensive sexuality education is not just talking about these intimate relationship between men and women. It talk about the consent, it talk about the healthy relationship, it talk about the sexual and reproductive, it talk about the sexually transmitted infection, how to get consent. So this way, these adolescents and children, that's the foundation for them to learn correct information from the school and from the education department. That's the takeaway for me, to closely link and work together between education department and health department. Thank you.
Thank you. Thank you so much. Thank you, sir.
Thank you so much. I believe he actually echoed my thoughts. Okay, 60 seconds. He echoed my thoughts. My final words is, let's collaborate better. As civil society organizations, as private entities, as government organizations, together we can do more, actually. And I'm not just saying it because this is something we always say, okay, SDG 17, partnership for the goal. But more than ever, if we had just SWAG come up today to say, oh, they are hosting a national IDP conference, the outcome would have been less, as opposed to us having this myriad of partnership, different organizations, different